My name is Dana Arnone. Believe it or not, I once dreamed of a career in fashion journalism, but life had other plans. I became a registered nurse and eventually the owner of a home health care agency in Long Island, New York. Now, I'll be honest, some days are hectic and sometimes I just want to scream, but my mission and my passion is what keeps me going, helping seniors navigate the chaos of aging in today's world. Every day I see the challenges our seniors face, and it drives me to fight for change, because no one deserves to face the end of life alone. After all, sooner or later, we will all be seniors. So come join me on this journey where we tackle the tough questions, uncover the truth, and fight for the dignity, fairness, and justice for our aging community. Welcome to Senior Care Matters. Welcome to Senior Care Matters. I'm your host, Dana Arnone, and today we are here with Assemblywoman Rajkumar. State Assemblywoman Jenifer Rajkumar made history in 2020 when she brought out 3 times more voters than ever before and defeated a longtime incumbent in South Queens. She made history as the first Indian American woman ever to be elected to New York State Senate office. In the 5 years since, she has made history yet again by driving through impossible legislative wins, focusing on human rights, environmental justice, and health. She is a graduate of Stanford Law School and the University of Pennsylvania. She was ranked as a super lawyer, practiced civil law rights, served as New York State Director of Immigration. She has taught also as a professor at CUNY, New York. Please welcome State Assemblyman Rajkumar. How are you?
I'm good. So happy to be with you.
Thank you. Thank you. I'm so happy to have these conversations with the legislators and, really opening up the dialogue as it relates to home health care, elderly care, and just health care in general. So I want to just start off by again saying thank you very much for the opportunity for people to hear, what you're doing and how it does impact home health care. So one of the first questions I see that you worked on immigration law and you're, I guess, very familiar with immigration. And right now we're finding in home health care, the immigration laws that are being passed are really affecting not only the staffing, but just the overall who's going into the care of the elderly in the home. So let's start by talking about this. So right now, what we're finding is with the immigration status of that's going on right now with the people entering into home health care, most of the time the aides that are coming are people that are new to the country or been here just a few years. We're seeing a very large decrease in the amount of people either coming or getting their status revoked, making staffing a big problem. So what is it that you think about that?
So first of all, I'd like to say thank you for coming here.
Yeah.
And this means a lot to me because also I come from a family of all doctors. I am a non-doctor, so you can consider me the family disappointment.
No.
But I tell my mom that I, as a legislator, am a doctor for the whole state.
Oh, I like that.
Yes. And I'm excited to be able to work on elder home care issues. And you're absolutely right about immigration issues, which make it a workforce that's already tight. It makes it even tighter.
Yeah, it's impossible at times.
It's impossible. Mm-hmm. I mean, right now we have over 500,000 New Yorkers in home care, but we're going to need a lot more to keep up with the aging population. By the year 2030, we're going to need at least 200,000 more. So those immigration issues just make it even more difficult.
Very hard.
Because this is an industry where it's hard to retain healthcare aides because of the way the pay is. Sometimes people go home with less than the minimum wage. When you factor in their travel times, some people have to go 2 hours each way for the job. And sometimes their shifts are broken apart. So it's a 2-hour shift and then 3 hours gap, and then they work 3 more hours. So it just doesn't make economic sense sometimes to be a healthcare aide.
No, and it doesn't make the job attractive to people.
Exactly.
And that's really one of the main issues that we find is that we're trying to change the perspective of home health care, making it a little bit more attractive for people to come into the position and really make it a profession. That's one of the things that we highlight a lot, that we want people to enter into the job and make it a profession for themselves, whether it's a stepping stone to move on to other things. But the problem that we're faced right now is most people can't, when they come to apply and they find that their status has been revoked, we're probably having like 20, 30, 40 people coming in a week, and probably we can accept maybe 5 to 10 of those people because their statuses have been revoked. So what is one of the solutions that the government is looking towards, or how can we help agencies, get through the staffing issue that's going on? Because it ultimately affects, the patients in the home, but it also affects the hospitalization rates of people, because without the care in the home, they're going to end up in the hospital, they're going to end up in long-term care facilities where they really don't want to. So we're always looking for solutions and how we can, I don't think we're going to fix the immigration problem at this moment in time, but we can make it more attractive for people to enter into the profession. So what would you think is some of the solutions that we can look at?
Absolutely. You've asked a really good question.
Thank you.
And I think at the federal level, we certainly have a lot of immigration issues to solve. We have to pass our comprehensive immigration bill. But I think it's great that you've asked about the immigrant workforce, because home health care aides, 81% are people of color.
And female.
And yes, and 88% of them are female, and a large majority are also from immigrant communities.
Yep.
So I think that one thing that we have to do is make home care not a dead end. It's like if you become a home care aide, well, you could become a RN soon. If we can somehow create training and make the profession more attractive, like you said, treat it like a real profession.
Yeah.
And that includes benefits, a living wage. It includes perhaps reimbursing travel costs. That would all help make this a real profession and make it attractive to these emerging communities that we've talked about.
One of the things that comes up a lot in home care, being that it's for now or for the most part, an immigrant-based industry, is language. And they don't always have the greatest command of the English language, which bothers the families, because every family says the same thing to us. My mother's 95, my father's 95, they're hard of hearing, they can't get the languages, they don't really understand accents. Can we have someone that speaks English? We would love to, but not everybody speaks English. So what is it, do you think that there would be some type of an opportunity to give free English classes to home care workers, even on the medical side, like just basic medical, type of words, or really elevating the type of schooling or education or accreditation for these workers? What do you think about that? And schooling?
Yes, this kind of training is so important to make this a real workforce. And I think we need to offer definitely English language courses. And also, a lot of these immigrant workers, they have experience in other countries. So that should maybe be accredited.
That's so smart.
As well as informal work. A lot of the aides already had a lot of informal experience taking care of people. Maybe that should also be accredited.
That's actually very smart. I never thought of that, because right now what happens is if they worked as a CDPAP worker, they can take what's like an accelerated class. It's a one-day class. They do skills. They do a written test. If they pass both of those and they've had experience of 3 months or more here, they can get their certificate in a day.
Absolutely.
Yeah, but that makes sense, because we do have a lot of people coming, doctors in their country.
It's all about investing in this workforce.
Yes, and
that's what we need to do.
Yes, that's actually the best definition, that we need to invest in them. They deserve it, and I think our seniors deserve it as well. When an aide goes to a patient's house, they're given, the care. They understand the patient that they're going to, but their pay rate is the same. Doesn't matter if you're dealing with an ambulatory patient that's very high functioning, that just needs some supervision, or they're dealing with someone who is a very high acuity patient where they're bed bound. There might be some wounds that they have to make sure they're clean and dry. So there really is a very large disparity in what somebody gets, what type of care that they're rendering to the patient, and versus their pay. So I always say that we should be looking at the level of the care of the patient and equal to the pay scale for that worker, so that it makes it more attractive for these people to come into the job and take care of these patients that really do require a lot of care, and they want to stay at home. So those are one of the, something that I think that we should look at, because it's a big problem. So the other problem that you mentioned that we see a lot is transportation. Transportation for the workers is nearly impossible. So we always advocate through our nonprofit for transportation to be somewhat reimbursed through the state, or some type of tax credit or something, so that these workers can get to their jobs. We did a PSA to prove our point. It's called Enid Story, so hopefully everybody will take a look at it. But what we did, we followed a worker in Queens. She lived actually right around here. So she lived in Queens. She lived in Queens. Her patient was in Queens. We filmed her from 7 o'clock in the morning when she left her apartment, followed her 3 buses to the patient's house, then back home. She got home at about 8 o'clock at night. So she left at 7, returned at 8, but her shift schedule was 6 hours. So she's only being compensated for 6 hours, but she's out of her home almost 11. Who's going to want to do that job? Like, something has to change. When we followed her too, a lot of the times she would miss her bus, or the bus didn't show up on time, and she knew that the patient's family had to get to work. So being timely to get to the patient's house was very important for her. So she would end up Ubering herself if the bus didn't show up on time, which is not a cost that's reimbursed to her. So those are the things. Transportation is a big, huge issue. I'm sure it's an issue here, but specifically on Long Island. So is there any potential of any type of intervention as far as the tax benefits to these people, or maybe some ride sharing that goes on for people so that they can get to their jobs?
Yes, that is so important, especially in transit deserts, like here in my district.
Yeah.
I know what it's like for someone to be elderly and living in Ozone Park, for example, or Richmond Hill or Woodhaven, and not be able to receive the care that they need because they just can't get anybody to come there. So absolutely, I think the state could get involved with reimbursing for transportation. Yes, it's a worthy cause.
So the other thing I say to people all the time is, like, I'm not overly familiar with Queens, so I don't want to act like I know the area. But when we get cases, Astoria, you would think no one can get to Astoria. It's a very hard place to get to. There's no buses, or if there is a bus, then they have to walk the rest of the way, which it makes it unattractive for someone to take that job.
Exactly. And why would someone do this job when they could be a fast food worker, for example, which is in some ways a lot less labor intensive. Or, I think it's also very interesting to consider how our society values care work. People might argue that we don't really value care work as much as other types of work. And you can see that if you compare the salary of, say, a daycare worker and a parking lot attendant, the parking lot attendant makes a lot more money
and tips
for just standing there.
Yeah.
Whereas the daycare worker who's involved in very laborious care work makes significantly less. So that's a larger picture. How does our society value care is one of the issues here. But that's very abstract. But you mentioned some concrete ways that the state could help. And I think transportation is certainly one way. And making sure that we have oversight over the Medicare plans, the Medicaid plans, to make sure that every dollar is spent the right way. Every Medicaid dollar should go to the older person at home in the chair. Every Medicaid dollar should go into making sure that the aides are paid appropriately.
Yeah.
And there needs to be strict oversight to make sure that that happens.
One of the major payer source for care for the homebound is managed long-term care Medicaid.
Yes.
So managed long-term care has its benefits, but it also creates a large barrier for care to be rendered in the home. So what is it that your position on managed long-term care? Because I know this is probably a very sticky subject. I know that we were talking to Senator Rivera, and he wants to get rid of managed long-term care and go right back to the county level. So is that something that you agree with?
Well, I think that there are definitely oversight problems that we have to take care of.
Yeah.
And it should not be that the Medicaid plan is being is gaining a profit while the agencies suffer.
The agencies do suffer.
And while the home care workers are not being paid what they need. That is an imbalance that we have to fix.
Not only that, though, but what happens is that the managed cares are dictating the hours that the patient gets.
That's right.
So when they're looking at, this is a whole other big issue that we see, is if you have someone with cognitive issues, so dementia, Alzheimer's, their level of skill is probably very low, but their supervision is very high, meaning they need 24-hour care, but they can toilet themselves, they can go into the bathroom, they may be able to even dress themselves. So on paper, they look like they're okay, but that supervision is so important. Managed long-term care doesn't cover someone for supervision. So you're seeing a lot of these patients get 3 hours a day, 4 hours a day, when they really do need 24-hour care. One of the things that is going on right now is the NHTD waiver. Not everybody's overly familiar with it, but that is one of the payer sources outside of managed long-term care that allows a cognitively impaired person to get those supervision hours. They're looking to cap. They're looking to not do more enrollment. So now you're going to have all this population of patients that are in the community. They want to stay in the community. Their right is to stay in the community, but yet there's not going to be that payer source for them to have that overall supervision. So there's a lot of, I think, fixing to do with managed long-term care and the oversight. It definitely starts with oversight, especially being an agency owner. I see it every day. We see the way that it's not always in the best interest of the patient or the worker. We're very big advocates for home care workers. One of the things that you had mentioned is the ladder of success for a home care worker. Myself, I was an aide while I was going to nursing school, so I 100% believe in them, rising up if that's what they choose to. One of the things is 1199 Union does offer that. They are promoting very much of the ladder of success for home care. So I think that that's something very important. People should know that it's something that you can use as a stepping stone. It's something that you can do, to move yourself up. One of the things that we have done too, which is something legislators might want to look at, is making it a mandatory clinical rotation for nursing students. So when nursing students are in classes or doctors, they should be mandated to go do a clinical rotation through a home care agency. That's not really one of the clinical rotations right now. So they don't really get exposed to discharging that patient home. They're not thinking about what does the house look like or do they have food. There's a lot.
That's a very interesting idea. I think I'd love to explore that.
Yeah, we do that. We have a partnership with Farmingdale State College, so we actually rotate nursing students, and I'm usually the only time that they'll ever see home care. But it's so important to make sure that if they're, wherever they go in their nursing career, ICU, wherever, ER, that they're looking at that person when they're going discharged home. It's not just sending someone home. There's a lot more involved.
Another issue I think we need to watch are the rates, the reimbursement rates.
Terrible.
And that with the Medicaid long-term plans, if the reimbursement is cut even by $1, it sounds like no big deal, but it really is a huge deal because that means workers are not getting paid. It means the care is not being delivered.
Yeah.
And so it's, like I said, it's also not morally correct when the plan is profiting, but the agency is squeezed.
Yeah.
And that's the situation that we have, which is why, as a legislator, oversight and accountability of this industry is critical and something that I focus on.
Thank you for that comment. We're going to come back and revisit that in a second.
Okay.
We'll be right back.
Body by Peter offers a premier at-home concierge service specializing in empathetic lymphatic massage and blood circulation enhancement. We provide a range of therapies, including red light therapy, wood therapy, body sculpting, and lymphatic detoxification. Our professional and compassionate approach ensures a rejuvenating experience in the comfort of clients' homes. Servicing Manhattan, Queens, and Long Island, New York. Call today, 516-509-3825. Every day, home health aides travel miles across our city to care for seniors who depend on them. But too often, long commutes and poor transportation keep them from reaching those who need them most. At All Things Home Care, we're changing that. By providing subsidized rides, we take the burden off caregivers so they can focus on care, not the commute. Because when caregivers are treated with dignity and respect, our seniors stay safe, cared for, and never alone. Join us in supporting the people who care for our loved ones. Learn more at allthingshomecare.org. We all say, today is the day that we tackle the organization of our homes. The day gets further and further away, but the job never gets smaller. We can take the headache out of planning and doing. We start with a free consultation, create an action plan, and bring you the space and peace of mind you need. We help with home decluttering and organization. Restore your home to a place of comfort. Call today, 516-322-2613. At Reliance Home Senior Services, we believe every day shines brighter at home. As a licensed New York State-based agency owned and operated by a registered nurse, Reliance brings over 20 years of experience and personalized care right to your door. Our certified personal care and home health aides assist with bathing, grooming, dressing, medication reminders, light exercise routines, and to accompany you to appointments, all while offering companionship and a safe, caring presence. Need help navigating Medicaid? We're here for you. Our team of registered nurses and social workers offers in-home geriatric management, so both you and your family can breathe easier. And with 24/7 on-call support, bonded and insured aides, and a custom plan of care crafted just for you, we bring peace of mind right into your living room. Reliance Home Senior Services, bringing comfort, independence, and trust home.
Welcome back to Senior Care Matters. I'm your host, Dana Arnone, and today we are here with Assemblywoman Jenifer Rajkumar, continuing the conversation on where we just left off, which is the Medicaid reimbursement for agencies. You know, you're talking about something that's actually about to affect most agencies now, whether it's the Medicaid cuts. A lot of the managed long-term cares have already taken away $1 from the reimbursement of the agencies, but yet the aides salary has to stay the same because it's a state salary that's mandated for the agencies to pay. So right now we're seeing that the rates should be coming out soon. They're probably not going to give us a rate increase. They're probably going to keep it the way it was if they don't lower it. So that will create another problem with agencies closing, people not getting the care that they're entitled to or what they're looking for. So I think that that is something that is very important. It should definitely be looked at because managed long-term care, in my opinion, although they pay us, our salaries at times, but it is a problem. It definitely takes away the control from not only the agency, but also for the people that are receiving the care. So that's a big thing. One of the things that we wanted to talk about is your bill that you have submitted, and it's for lowering the cost of generic drug plans. Is that okay? Let's talk a little bit about that.
Yes, so it's the Affordable Drug Manufacturing Act, and it aims to break up the monopoly of big pharma. Because right now, drug prices are so high for a lot of generics like insulin, even though it doesn't cost much to make them, only a few dollars. So unfortunately, a lot of New Yorkers can't afford life-saving drugs. And this situation has to change. It doesn't have to be that way. So what my bill does is it says that New York State can actually contract to manufacture its own drugs.
Oh.
And actually, it's been done. California is now doing it, and it works. It's doable. All it does is it makes the market more fair. It breaks up the big pharma monopoly and drives down drug prices. So there's a lot of momentum for this bill.
Congratulations.
And I'm very optimistic and hopeful that it can get passed.
So how do you think that would affect, so it will affect the seniors specifically? So it would lower their cost of any out-of-pocket expenses? Is it through Medicare? Like, would Medicare be helping pay for that? Because I know, like, there are a lot of the patients that we deal with, they'll have Medicare as a primary, and then either they're electing into managed Medicare, which would cover some of the costs, but they still are paying a lot for it. So,
correct.
Okay, that's good. I think that people will definitely support that. One of the things that I did want to talk about as well today is that I find it to be, it goes back to the care of the elderly. Right now, we're seeing a lot of different things in the news. And, you and I discussed this just prior to coming on, all the things that are going on in Newsday, that I think it really is telling on not only how we treat the elderly, but how we consider the elderly. There's been 3 different episodes of things that just occurred within the last couple of weeks. One, you had a home health aide stabbing a patient in her home. It's terrible. Then you have another one that was in Newsday, these companion agency. There was a specific companion agency on Long Island. I won't say who it is, but they were cited for not being a licensed agency. So they're caring for people at a level that a licensed agency is supposed to be caring for them, and they're not. So they're sending unqualified people to people's homes to care for the elderly, and a lot of times these families don't even understand of what's happening. They're calling an agency, they're not understanding that it's not licensed, and they're sending people to the home that are not equipped to care for their loved one. And then another thing that just happened is an aide was arrested for sexual assault in a nursing home. So in a couple of weeks, we're seeing all these things happen to the elderly, to the patients, whether they're home in a nursing home. It's an issue. And I think it's definitely an issue that, legislators should stand behind and start looking at, because it's terrible, when we're looking at, especially with the companion agencies, they're not regulated. No one's overseeing them. They're all private pay, so there's no pay source from Medicaid or anything. So they're just sending people out to people's homes that they're supposed to be caring for them. So what is it? What would you do, or how would you look at that as an issue? Because it's definitely
elder abuse issues mean so much to me. It's very concerning. Yeah. The cases you mentioned are egregious.
Yes,
and 1 in 10 older adults will suffer abuse. So it's a drastic statistics. And also, very few of them actually report the incidents. I think that we can implement some fixes. There should be a hotline where anyone can call the centralized hotline and report abuse and then get quick help. I think that's very important. Number 2, background checks. We need to step up background checks of aides.
Yeah, oversight.
Yes, exactly, oversight, because that could possibly prevent the horrifying examples that you just gave me
Yeah,
of
it's terrible.
sexual assault. But this kind of abuse happens in different ways. It can be physical, but it can also be emotional. It can also be financial, stealing money from the patient. It can be neglect of different kinds. That all counts as abuse.
Yeah. I just think that it also is very telling, and it speaks to, all of a sudden, all these things that our seniors are faced with, and their families are faced with, and all the different things that they have to worry about. So not only are they worrying about, their mother or father being at home, they have to worry about their own jobs that they're trying to keep, but yet maintain their loved one at home. There's a lot of, there's just a lot of sadness going on right now. And I think that it's really time to take a look at, how we treat our elderly and how we're treating the workers as well. The workers are very stressed out, home care workers, and we want them to stay in the field. We want them to be encouraged to come in. And I just think the whole system needs to be revamped.
Absolutely.
That's my
Absolutely.
mantra.
People shouldn't have to send their parents and grandparents to an institution.
No.
They should know that they can be at home.
Yeah, if they want to.
If they want to be, yes.
Yeah.
And if we have a system that works, if we treat the workforce like a real workforce,
Yes.
and we have strict accountability, and we retain workers, and we have training programs, all the things that we discussed, we can make it work, and
I think
people
it's-
can age in place at home.
So I want to thank you so much for your time. I think that people should start to really look at legislators. So I tell families, if they're upset about something, if they're questioning something, I tell them, call your legislators, call your politicians, call the decision makers. Those are. I don't think that sometimes they really. Someone in your position as an assemblywoman or even a senator really understand or see the day-to-day operations and what goes on in home health care and how important we really are in that wheel of health care as far as keeping people home, keeping people safe, keeping them out of the hospitals, lowering that hospitalization rate. And really, you'd want to stay at home, you'd want your mom at home, and I feel like everybody deserves to make that choice.
Absolutely. Well, I encourage everyone in the home health industry to contact me, no matter where you are in New York State. Contact me. I want to hear from you. I want to hear about your daily experiences. And as someone who sits on the health committee, I'm here to make a difference. I'm here to make people's lives better. So I find this is a very exciting discussion. And let's see how we can move the ball forward.
Thank you, Jenifer. I really appreciate all your time and the insight that you've shared with us. I think that you are definitely someone that people should contact and look for as far as help and assistance, because you seem to have a pretty good understanding and handle on what's actually happening out there. So I do appreciate your time.
My pleasure.
Very good. I'm your host, Dana Arnone, and this is Senior Care Matters. We'll see you next time.